home care aide along those lines are the same thing. Some of you already may know what home health aide is, but I am going to still explain for those of you that may not know. Home health aide is workers trained to provide basic care to people who are unable to care for themselves. The role you play may keep clients in their homes longer than facilities. So, in that sentence, it's talking kind of about the elderly or disabled people that would possibly have to go to nursing homes or retirement homes, things along those lines, and having an in-home care aide would give that support to where they can stay in their house as long as they can possible. Who do they help, you may ask? Well, people of all ages, including the elderly. People with disabilities or chronic diseases. It can be any person that you meet. They will help anyone. What do they do? Well, sometimes it all depends on each client that they see. It could be assist with daily activities, which can include bathing, dressing, grooming, med reminders, client errands, which could be running to doctor's appointments, going out shopping, going out for a drive, just getting them out of the house, just to do something so they don't feel cooped up. Also, checking vital signs, monitoring clients' physical and mental well-being. So you may be there more than the family is, so you can kind of tell when something is wrong, or say that they may be walking different, or they might have fell and you noticed a bruise or something. You'll be able to notice that. When I first looked into this job, I thought you may need a high education or, something like a CNA, which is a certified nurse's aide. Well, what the research I've looked up is you basically just need a high school diploma, which they will do on-job training. Some states may have a program or a classroom instruction that they require. Or, just having a background working in assisted living, nursing homes. Working with caretaking is really helpful. Some skills that you may need, but you already probably most likely have: time management, problem solving, basic medical knowledge, and compassion. Physical stamina, patience, communication, adaptability. These are just some of many skills that you may need, but you already probably most likely have. Having these skills will benefit the client more. Being compassionate about the job that you are doing will bring the client closer to you and make them actually feel like family to yourself. There are many other skills that everyone has that would be very valuable in this type of career. Outlook of 6, which is also facts that I have found. The U.S. Bureau of Labor Statistics estimates that the number will increase by 21% from 2023 to 2033 of in-home care clients. Each year, about 718,900 openings for home health aides are projected each year, on average, each decade. There are currently over 512,828 home health aides employed in the U.S. 86.4% are women and 13.6% are men. Home health aides is one of the fastest growing jobs in the U.S. Now, one state in the U.S. that has the biggest demand is New York, New York. Advantages and disadvantages. So here are some advantages: flexible schedule, trusted position, personal interaction. These are just some of many advantages to the job. Having a flexible schedule may benefit you personally and also the client. Personal interaction, if you like the one-on-one connection with each client, it is a very good opportunity with this job. Now here are some disadvantages. So the lack of structure. So you kind of are on your own when you go into each client's home. The lack of supplies. So yes, some businesses may supply you with gloves and masks and, give you some money to provide for those. But most of them are out of pocket that you have to buy your own supplies. Uncooperative clients. Now that is a major one. Each client has their own set of mindset. So you may go to one client and they're very welcoming and very easy and tell you, thank you, you've done an amazing job. Now another client may not want to do the things that they possibly should do to take care of themselves.